Hey, have you ever posted a quick photo of your lunch or workspace without really checking the background? Maybe a screen was left open, or a file was lying out, or a name tag was visible on a prescription bag. Seems harmless, right? But in healthcare, that kind of background noise can turn into a serious violation. That's because protected health information, what we call PHI, has a way of hiding in plain sight. And even small moments can lead to big consequences if you're not careful. Hi, I'm Sherrina Hansen. I have a degree in business and certifications in medical coding, auditing, compliance, and education through the AAPC. I've worked in healthcare for over 20 years, supporting teams in hospitals, clinics, classrooms, and if there's one thing I've learned, it's this. Most HIPAA violations do not come from bad intentions. They happen when people don't realize what the rules are or how easy it is to break them. So that's exactly why this mini-series that we created is to help you recognize PHI in the real world, not just in policy documents. Because in healthcare, PHI isn't limited to formal records. It can be in a hallway whiteboard, a voicemail, an overheard elevator conversation, or even a social media post that you didn't really think twice about. So whether you're clinical staff, admin, billing, or even behind the scenes in IT or support, if you're exposed to patient information, then this applies to you. So we're going to break it all down. What qualifies as PHI, how breaches happen, and why protecting it isn't just about compliance, it's about respect for patients, for their stories, and for the trust that they place in us every single day. So let's dive in. Just a quick disclaimer, this course is for information purposes only. It does not count towards a HIPAA compliance qualification.